Welcome back to the UBC Learning Circle. Together with the Indigenous Research Support Initiative, we are pleased to be able to bring the Dada Nentsen Gha Yatastɨg ilhqot'in in the time of COVID report to everyone today. Before I get into anything else, I would like to acknowledge that I'm zooming in from the traditional, ancestral, unceded, and occupied territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So, gentle reminder here today, the topics we cover can sometimes be sensitive or emotionally triggering. If that's you for today, please make sure that you're looking after yourself. If at any point you feel that you need to talk to a friend, elder, counselor, family member, don't hesitate to access that support network, whatever it looks like. So briefly, introductions. My name is Cole. I'm from the Chowithil First Nation. Sharing our digital space today, but off camera are Cynthia, our production coordinator, and Amber from URSI. If you feel so inclined, please introduce yourselves in the chat box so we can kind of get that dialogue started. It's also my sincere pleasure to welcome Mary Ellen Turpel-Lafond, Senior Associate Counsel at Woodward & Company and Professor of Law at Peter Allard Hall Law School at UBC, to the conversation today. She'll be facilitating the rest of the session. Mary Ellen brings her extensive experience in the field of Aboriginal law to her current practice and to her work at UBC. She served as a Saskatchewan Provincial Court judge for 20 years. She served as BC's first representative for children and youth, a role that saw her take on case advocacy for more than 17,000 youths and their family, most of whom were Indigenous peoples. Mary Ellen holds a doctorate in law from Harvard Law School, a master's in international law from Cambridge University, a JD Law degree from York University, and a Bachelor of Arts degree from Carleton University. She also holds a certificate in the International and Comparative Law of Human Rights from the University of Strasbourg. And she's a member of the Indigenous Bar, as well as the Law Societies of British Columbia, Nova Scotia, and Saskatchewan. She's the recipient of numerous prestigious awards and the author of more than 50 published works and reports, including In Plain Sight, addressing Indigenous-specific racism and discrimination in BC healthcare. That report is the result of the province's independent investigation into anti-Indigenous discrimination in the healthcare system. Again, it's my sincere pleasure to welcome you, Mary Ellen, into the space here today. I'm looking forward to the session, and I'll leave it up to you from here on out.
Thank you so much, Cole, and welcome everyone zooming into this webinar on such an important topic. And I'm just really pleased to be the moderator today, and I'm zooming in from Lekwungen speaking people's territory. So I'd like to acknowledge that I'm on the unceded and treaty territory of the Songhees and Esquimalt people and WSÁNEĆ peoples. And I'm really delighted to be here to talk about the report and the experience of the ilhqot'in in terms of responding to COVID. We have quite an incredible group of people who will be talking today, and we'll be taking your questions, and we'll have a chance to delve into a subject that is, it's rare that we get to delve into a subject that is so immediate and meaningful and important on a daily basis, but also speaks to the issue of resilience and the role of a nation, and in particular, a nation in British Columbia, a First Nation that has stepped up in a way that is unprecedented and really is a model, I think, for all of Canada. And as Cole said earlier, recently I completed a review of anti-Indigenous racism in healthcare. And while I was doing that review, parallel to it was this incredible report that was being prepared on ilhqot'in in the time of COVID. And we have today the authors of the report, and we also have Chief Joe Alphonse to put this report in context and to talk about the work of the ilhqot'in, the life work of the ilhqot'in to protect their territory, their identity, the health and well-being of their citizens, their elders. And that's not just something that was done, 3 or 4 months ago. This is an ongoing and daily issue. So I want to start out by introducing and welcoming Chief Joe Alphonse. And many of you, not only in British Columbia, but in Canada, will know Chief Joe Alphonse. I've had a chance to work with Chief Joe in many ways in terms of his passion and commitment for his community, children and youth in his community during my time as representative for children and youth. He's been the tribal chairman of the ilhqot'in national government since 2010. He is one of the longest serving chiefs, ilhqot'in chiefs. He worked with his colleagues to ensure that the title and rights of the ilhqot'in were asserted. And as many will know, there's been a path-breaking decision in the Supreme Court of Canada that was attributable to Chief Joe and the other chiefs bringing forward with their elders, their matriarchs and leaders, their oral history, and to assert their status as a nation. And it was the first recognition of Aboriginal title, specific designation and recognition by the Supreme Court of Aboriginal title. Chief Alphonse is a fifth generation ilhqot'in chief, and he is the direct descendant of Chief Anaham, who was a Grand Chief of the nation during the Chilcotin War, which is also important. The history of the nation is a significant history for everyone to learn and understand. And what is path-breaking about the report we're going to talk about today is it isn't just a report about an episode this last year when we've all been grappling with COVID. It's a report that talks about the deeper issues that the ilhqot'in have had to not only grapple with, overcome, and advance. And it's important because it puts it in context. And the struggle to deal with COVID and to respond as a community is a deep struggle. And with that, I want to bring in Chief Joe to the conversation. And just to say welcome to you, Chief Joe. Thank you for being here today. Thank you, first of all, on behalf of all British Columbians for leading this important work in this report. And thank you to your community members who worked with the researchers to be able to share this with us and give us a chance to talk about today. The first sort of question I have for you, Chief Joe, is coming from, in particular, your status and your role of having to fight and protect your people for centuries through historic, incursions into your territory, through modern crises, whether it's forest fires, and with COVID. I really want you to just sort of share with us, like, what is it you draw upon as you come to this and to try and assert and protect your people? If you could just talk to us a bit, Chief Joe, about where you're coming from as a people when COVID came and these historic other experiences you've had. Of course, there's smallpox, there's the more recent issues, there's having to struggle and fight for land rights, but also to lift and stand up your people every single day. So I'd like to bring you into the conversation, Chief Joe, welcome you, and have you kick it off by talking to us about where this report and where this work comes from.
I'd just like to thank everyone for taking the time, opportunity to allow us to share our story. I'm ilhqot'in, a couple things. I'm probably up till now the longest serving elected chief in Tlarinco. That's my community of Enaham. Not the longest serving Chilcotin chief we've been very fortunate that we have long serving chiefs. We 20 years, 30 years is pretty common for ilhqot'in chiefs, and I think that's really key to our success, having that stability. Although we have modern day election systems, our people still value our customs as ilhqot'in people, and a lot of things we do today is based on our traditions and what we value, and to put a lot of emphasis on just the value of our position. We don't agree with something as people and for your people, and you stand up for that, and regardless of what the consequences might be. We've struggled as people, as nation, with colony of British Columbia and later Canada coming into our territories. But we've always maintained who we are. That's the unique thing about Indigenous people. We all come from a certain region. and we get to know that region inside out, and we know how to survive and live off of that land. You want to get to know the land, get to know the indigenous people that come from there. They'll tell you the secrets of that land and stuff. So, we're very blessed that our stories have all been passed down from generation to generation, and it continues and is very strong in Chilcotin culture. We've had smallpox dealings. We've had, different times before contact where our salmon wouldn't come back. We're very salmon dependent people here in the interior and stuff. So we hear that, we learn that, and as we move forward and these pandemics come up, we draw on that experience. We draw on that history. Smallpox killed anywhere from 80 to 90% of our population at one time. And when our healers, our medicine people, they went into all their ceremonies and all of that, they weren't able to come up with a cure for smallpox. In the end, it was decided amongst all our people that the best avenue was to separate everyone. All the clans had to separate, and for 1 full year, no visiting was allowed. And at the end of that year, it was all agreed we were going to all meet back at a certain location. And when that year was up and our people came back, only 10-20% of our people came back. And that was pretty devastating. To have 80-90% of your population perish, and it was an isolation is what saved us, and it was nice isolating ourselves for a full year. So when we do our struggles against COVID-19, to ask our communities to shut down and isolate themselves for 2 weeks, I remind them of that. And the strongest policies we have as Indigenous people is when we can bring back our old laws and we rewrap it in a modern way and roll that out. And when people hear that that's an old traditional law, they adhere to that. It's not something that's being imposed by RCMP or Canada or ISK or anything. And that's what we have to draw on. So it's very, very important as Indigenous people to know your history, meet, consult with your elders, and all of that stuff. So it's been, and for myself, I come from a hereditary family. I'm not a hereditary chief. My cousin Kirby is, but I'm the only person from the hereditary family that's ever been elected into my community. So my grandfather Casimir was chief for 33 years. I'm going on 12 years now as chief, although I feel like I'm the one that's gone 33 years now with all of these situations. But at the end, you have to do what's best for your membership, and you're there to represent them, and always try to put your membership in a good light. And it's also important that we value ourselves enough that we want to tell our story. And a lot of places and communities where I came from, there were no policies, there were no books. When I got elected in, there was no blueprint or job description on what you had to do. So as we move forward and as we encounter struggles, we want that documented and recorded, so that any future ilhqot'in members or anybody else, any other nations can come along and pick up a report that we've done and have it laid out. These were the challenges. These are the things that you should expect. No matter how prepared you think you are, you'll never be prepared enough when you encounter any kind of pandemic or emergency situation like wildfires, flooding. So it's good to have that, and it gives our young people pride to know that we've done this and to record it. A lot of our history isn't recorded by our people; it's recorded by non-Indigenous people, and the non-Indigenous values is put into those reports. So we wanna put things in through our lens of Silhqot'in people, and that's why we're doing this. And of course, you can't just do a report. I'm very grateful for the team that we have. You're only as good as the people you surround yourself with, and I think we've been pretty fortunate in my career that we've always been able to pull together a pretty good team. So with Aboriginal title, we're constantly under the lens, and we wanna lead. We're not here to follow, and we know what's best for our lands, and we're going to push for that. And based on our history, we know what to do. We don't need anybody holding our hands. So that's where I'm coming from, and stuff. So I think I'll leave it there for now. Can provide more insight as we go.
Thank you. Yeah, well, thank you, Chief Joe. I just wanted to ask you one more question before we go into the next kind of panel. I know you talked about the team that has done this work. And one of the things I'm really struck by with the report is the what I call cultural humility. There's a team that involves some UBC, of course, Crystal, Jocelyn, Emma, who are with us today and going to talk, but there's a whole number of people from the nation who were interviewed, who stepped up. And this has been a really tough time. Like you talked about remembering smallpox and the decimation that smallpox caused. Having to talk about this, but also having to draw strength, and the kind of strength that you've drawn from the practice of pulling together and defending and protecting the nation. Like some of those early incidents when COVID came and the community had to just immediately protect the nation. And the kind of the report, but the experience really speaks to the way in which your traditions, your practices, your beliefs, and your values came to the forefront, because it looks a lot to myself as an outsider, and for someone who's worked a lot with my own First Nation and others, the government wasn't exactly there to help, right? It was like, boy, it's over to you. This is coming. You have got to respond quickly, shut down community, protect people, talk about why you have to protect. And just before we move on, Chief Joe, I just want you to talk about that a little bit as a leader. Like, how long did it take for you to kick into action? Because literally from an outside viewpoint, it was like instant almost. And you put in place laws to protect your citizens. You had one of the first major incidents of COVID in terms of someone coming into a community and potentially being someone who's bringing COVID with them, was someone that was coming back to your territory, and you had to kick into gear. I know it's been more than a year, but can you just talk to us a little bit, Chief Joe, about that immediate response? Like, where did that come from for you? Like, I know there's a big picture, but just talk about how quickly people kicked into action to protect each other.
Yeah, it's something like this hits. We'd all seen reports. We'd all, doing our own research on what COVID was, and there was a lot of fear and stuff. So, we talk about emergency planning in general, whether it's protecting our community from fires or pandemics or anything like that. So, we're fresh off of the 2017 fires, where we had put a lot of energy and time into that. So we were very well rehearsed in terms of responding. But it's my community is we're about 2,000 people, so we're gonna encounter, if anything out there, my community is going to be one of the first communities that are hit, and we're the most central of the Tlahtolko'in communities. We're 45% of the Tlahtolko'in population, and we have a lot of members from other communities coming into our community. And so if anything's going to happen, it's probably going to be in my community. And so when that hit, you have to respond quick. It's very important. As a leader, I don't want to face those things. Where I'd rather have an easy time of things. Why is it that that during the 2017 fires I was the chief, and why is it I'm the chief now and world pandemic has hit? It's very stressful. It's very it's what do you do? How are we going to deal with this? And you definitely go through those feelings, but you have to do the right thing. And when you have to respond, the sooner you respond, the better, because your community is going to resist that. The first week of shutdown, was the most difficult. We haven't got all the education out to our community members. Education often is the key in getting cooperation from your community, because you're not going to have any help. RCMP, their response was, we don't enforce policies. We're here to enforce the law. So we didn't see the RCMP. You're going to have racism, from local businesses, nearby towns, and all of that. So you better get this, and you better get your community members in line. And the first week, and it's traumatizing for our community members. The comment we heard most often was, you guys are trying to treat us like residential school. We're not allowed to do this. We're not, but at the end, you have to remind them we're not doing this. We're to be spiteful. We're doing this to protect you, our whole community. And then you get into, the dialogue about our past history and smallpox and stuff. So once people are aware, they're very supportive. But there are circumstances you can't control. We had a fellow come down from the Lower Mainland from a correction facility, and again, that put us in a situation where we did the shutdown. But as it turned out, we didn't need to do that shutdown, because when he came through our community, he had tested positive, and he had quarantined for 2 weeks. But we didn't know, and the facilities that were out there, the correction services and all of that, stated that because of privacy and all that kind of stuff, that they couldn't share any information with us. My argument to them was that an Aboriginal right is a communal right, not an individual right. So when a person comes from Indigenous heritage, they belong to a communal right, then the community has the right to know about their well-being and stuff. And if we had access to that, we would have handled things in a different way. But those are the challenges, and you're going to have, as I often told people during the 2017 fires, we were the only nation that said no to an evacuation order. The fires were never a threat to us. Government officials were. And I'll reiterate that, again, your biggest hurdles are going to be government people wanting you to be under their thumb, when that's not acceptable to us as Chilcotin people. We know how to deal with this, and We'll make mistakes, but we'll own them because there are mistakes and we'll learn from them. So give
Well,
us
thank you. Yeah, thank you, Chief Joe. And we just for the participants, we've just put into the chat also the Fires Have Awakened Us report. And I just want to say that we're going to have lots of opportunity to have some questions and more discussions with Chief Joe. And you've really framed that piece of how you kicked into action, but also the protection the Silcotin people have toward each other and not needing to be told what to do by government to be able to do that, but also expecting a respectful relationship with government. That does run through the report. And I'm going to turn us to the panel, and we're going to have a chance to come back and have more dialogue with Chief Joe. But I want to introduce the panelists who are leads responsible for getting this report out, working together. And the three of them are going to sort of walk us through a presentation and inform. And I just want to introduce them briefly. You can see their bios are available in the materials for today. And contact information is available. So first of all, I'll just do it in alphabetical order. First of all, we have Emma Feltz, and Emma is a PhD candidate in the Department of Anthropology at UBC, and she's a writer, organizer, and policy analyst with more than 10 years experience. Her work really focuses on Indigenous and settler relations, and she was working on projects with the nation since 2013, and she worked on the Fires Awaken Us report as well, and on this report, and just so grateful for her work. And of course, just myself as a professor at UBC and as the director of the Residential School History and Dialogue Center, someone who is going to be making a lifelong contribution to this area in her scholarship and the way she's working. I'm just so proud of her work. I really want to stand her up. Dr. Jocelyn Stacey, who's my colleague at the Peter Allard School of Law. She's a very well recognized researcher in the areas of disaster law and environmental law. She has been working with the Silcotin since 2017. She is one of the co-authors of The Fire Awakened Us, as well as this report on the community, the nation's response to COVID. Very pleased to have her as a colleague at Allard, but also as I was working on the report on anti-Indigenous racism, just to have the kind of support and expertise and knowledge of a colleague of the caliber of Dr. Jocelyn Stacey. Just so privileged at Allard School of Law to have her present. And last but certainly not least, Crystal Verrer. Crystal is Silcotin. She has been a lead negotiator, special advisor to chiefs. She's been a supporter in her community and her nation, working with the traditional and elected leaders. She has degrees from Mount Royal University in Calgary, and she has a Master's of Business Administration from the University of Northern British Columbia. She also has operated a design and web consulting firm. She's incredibly dynamic and resilient individual who contributes at many, many levels, not only within the nation, but throughout British Columbia and Canada, also contributes to a number of projects and initiatives with Indigenous women that I'm aware of. And I certainly really want to stand her up as well and recognize her incredible service and work to supporting the efforts of Silcotin and the nation for some time at the negotiation table, having to stare down government frequently. And I really think about Crystal when I read this report, because so much of trying to get ready to address a crisis is about whether or not the space is given to the nation to do the work it has to do. And Silcotin, through their negotiators and their chiefs, have pushed hard to create that space. And this report will talk about whether or not there was enough there to support them and what needs to come of it. So I'm going to pass it over to the three of them to present. And again, links to the report are available here and on a number of websites. You'll also see them in the chat. I really urge you to read the report in full and disseminate it and talk about it, especially amongst our colleagues and friends in the First Nations community across Canada. This is an incredibly path-breaking report in terms of its method and its content. So I'm going to pass it over to the three panelists to present further to us. Thank you.
Thank you for that, Mary Ellen. So we have a slide deck, so just take a second and wait for our slides to magically appear on the screen here. Thanks so much, Cynthia. So good morning, everyone. It's really a privilege to be here with you, and thanks to Cole for opening up the session in a good way, and thank you so much to Chief Joe and Mary Ellen for your really important opening remarks. I want to start by saying a really special hello to all the ilhqot'in citizens and all the staff within the nation and the communities who I know are joining us here today. I've seen you in the chat, so hi, it's nice to be here in this virtual space with you. I'm one of 3 members of the ilhqot'in National Government's Pandemic Research Team. I'm a settler, originally from Alberta, Treaty 6 territory, a law professor at UBC, and a very grateful, though uninvited guest on the traditional and unceded territory of the Musqueam people, where I am joining you all from today. I've had the tremendous privilege of working with and learning from the ilhqot'in Nation on emergencies and the law since 2017. So what Emma, Crystal, and I have decided to do is, rather than trying to cover the breadth of detail in the report, is to provide 3 specific snapshots of the report's findings. So my role in the next 10 minutes or so is to introduce our approach to the research and to provide that first snapshot, the theme of which is partnership. Okay, so next slide, please. So the ilhqot'in pandemic report, ilhqot'in in the time of COVID, is an extension of the research-based work the nation has done since at least the 2017 wildfires in exercising, documenting, and advocating for its inherent jurisdiction in times of crisis. The experiences of the nation during and after the 2017 wildfires are documented in the report that's been mentioned already, The Fires Awakened Us. And many of the calls to action in that report are relevant to the pandemic as well. They speak to the fact that ilhqot'in leadership actively exercised its jurisdiction to keep people safe during the wildfires, as you've heard from Chief Joe. And the calls to action identify the infrastructure, funding, resourcing, and policy needs for supporting ilhqot'in leadership in emergency response. Here we are now in 2021 addressing the pandemic. And to summarize one of the themes that we heard in carrying out this research, it seems like the nation is always in a state of emergency. The only question is what the next one will be. So what we know from our research, what we know from disaster research more broadly, is that this experience of perennial emergency is not wholly the result of an external threat like the lightning strike that causes a wildfire or a virus. It's the result of social vulnerability. So that's the operation of colonialism and systemic racism, which makes Indigenous peoples vulnerable. So to put it differently, the emergency is historic and ongoing colonization. So Crystal, Emma, and I have worked collaboratively on the research for both of these reports. Our approach fundamentally has been to go where the nation needs us to go, and documenting the approach of leadership, the experience of the communities, the needs and institutional barriers which have impeded the full exercise of ilhqot'in jurisdiction. The challenge with this report has been to do it in real time, right? As the pandemic is still unfolding. We sought to capture the learning that was happening during the first wave of the pandemic very much in real time. But as you've heard already, this report is part of an ongoing story, one that extends back beyond the Fires Awakened Us, through the nation's long history with disease, and one that continued after we stopped writing, and as we're all aware, continues to this day. The focus of the COVID report was to capture how key pandemic response decisions were being made within the nation. So over the summer and fall, we interviewed 46 individuals, primarily within the nation, chiefs, counselors, the Women's Council, Emergency Operations Center staff, health directors, healthcare providers, and other community staff. We also reached out to provincial and federal agencies and interviewed representatives from Indigenous Services Canada and BC's Ministry of Indigenous Relations and Reconciliation. Representatives from Emergency Management BC provided written comments to some questions from us as well. We're really grateful that everyone was able and willing to meet with us really in those difficult early days of the pandemic. The result of all these interviews is an appropriately wide-ranging report. As we all know, the pandemic has impacted all aspects of social life, and the report attempts to capture how the nation responded to these impacts. What the report shows is that the nation's leadership and staff know what the nation needs, as you've heard, to navigate a pandemic. It also shows that the nation is constrained in fully exercising its jurisdiction to meet these needs. And it shows where important learning has happened and also where progress is being made. The report culminates in 40 new calls to action directed at BC, Canada, and the Silhqot'in Nation. Okay, next slide. So the first snapshot highlights one of the important positive lessons that emerges from this research, and that is that partnerships have been essential to the Silhqot'in Nation's pandemic response. And so I'll talk about three different ways. The first set of partnerships I want to highlight are the partnerships and supports shared between Indigenous nations. For instance, the Silhqot'in National Government, through its Emergency Operations Center, has an ongoing relationship with Westbank First Nation. And so last March, when the WHO declared COVID-19 a global pandemic, TNG's Emergency Operations Center reached out to Westbank, received a copy of its pandemic response plan, and then was able to adapt that plan to meet the needs of the Silhqot'in. The nation was also able to work with coastal First Nations to bring in fish for communities under shelter in place orders. In disaster research, these kinds of arrangements are called mutual aid agreements. So communities helping each other out in times of need. But these types of mutually supportive relationships are rooted in Indigenous traditions, although in many cases disrupted by colonization. Both of the Silhqot'in's reports on the wildfires and COVID call for strengthening and building back these relationships of reciprocity between Indigenous nations to support Indigenous peoples during crises. In addition, the Silhqot'in Nation worked closely in partnership with the Heiltsuk and Nachalmith nations in advocacy on receiving COVID data from the province. This included coordinating on a complaint to the BC Information and Privacy Commissioner, and lengthy negotiations at a health table with the province, including with Provincial Health Officer, Dr. Bonnie Henry. In the end, this coordinated and persistent advocacy led to data sharing agreements between the province and each of the nations, which partially satisfied the nation's requests. The second set of partnerships I want to highlight are the partnerships with the province and the federal government, and in particular, the many individuals who have worked to find solutions to the needs of the nation, to address the needs of the nation through the pandemic. In a moment, Emma's going to give you a sense of the sheer amount of administrative work that Indigenous nations are burdened with as a result of jurisdictional and policy complexity. This absolutely needs to be addressed by provincial and federal partners. But it's also really important to acknowledge that it is no small feat to be able to maintain constructive, respectful dialogue through a pandemic, which has been enormously demanding for all jurisdictions. The Silhqot'in were able, in most cases, over time, to work with provincial and federal staff in navigating and adapting the various processes and policies that have been implemented through the pandemic response. Okay, next slide, please. So finally, I want to highlight an important early success story in community response. You've heard already from Mary Ellen and Chief Joe about the intensity of the early response to the pandemic now over a year ago. And one of these early success stories was the partnership with food and supply distributors such as Cisco, which you can see up on the screen. Arranging wholesale food and supply delivery early in the pandemic met a number of needs, including addressing food insecurity, especially for households preparing for the possibility of 14 days of self-isolation, reducing the exposure of on-reserve members by alleviating a major reason for travel into the city, and providing needed cleaning and hygiene products like hand sanitizer to the communities at a time when I'm sure people remember those shelves in the grocery stores were frequently bare. So that coordinated and safe delivery of food and supplies was a major accomplishment, the result of a lot of hard work from from staff to make that happen, and one that has a lot of potential for formalizing or adapting in response to future emergencies to keep communities safe. Okay, so I'm going to turn it over to you, Emma, and Cynthia, you can advance the slide.
So good morning. Thanks, Jocelyn. It is such a pleasure to finally have the opportunity to have a discussion about this report. And thank you to Mary Ellen and Chief Joe for the fantastic conversation to get this event going. I have learned so much from your work, Mary Ellen, and from working with you and your community, Chief Joe. And I think it really is a privilege for all of us, this meeting of the minds, to get to hear the two of you in dialogue today. So I'm Emma, I'm one of the report authors. I'm a white settler researcher who's worked with the ilhqot'in in one capacity or another since 2013. And I come to you today from Algonquin Anishinaabe territory in Ottawa, where I'm temporarily based and where we are very much in the thick of the third wave. And as of midnight last night, back in our strongest level of lockdown. It's been amazing to work with the ilhqot'in national government and the ilhqot'in people on this report. And I've been thinking a lot about it these last few weeks as we've all kind of struggled to commemorate the 1-year anniversary of the start of this pandemic, and what a challenge it's been, I think, for all of us to try to put words or shape to it, or even begin to reflect on what's gone on. And it really struck me just how astounding it was to be on the other end of this research, doing Zoom and phone calls with ilhqot'in staff and citizens throughout the summer and fall, when they would, as Jocelyn said, in real time, in the middle of this crisis and in the middle of these compound crises that are described in the report, take a pause and talk to us and reflect on that first wave with just astonishing frankness and nuance. And so thank you. I know that many of you are here. It's really something to be doing research on something that we are all in the throes of, that we're all experiencing collectively, but also that we're experiencing so differently based on systemic inequities. And it's the sort of quotidian level, the day-to-day experience that really sticks with me. And so when we talk about jurisdiction in policy and legal research, and when we talk about crises as well, we tend to think about and write about these things as kind of momentous and grand and structural. But as a legal anthropologist, my focus tends to be on the minutia of our lives, the kind of thorny, sometimes ridiculous, sometimes infuriating interactions and habits and logistics that make law real on the ground. These spaces where jurisdiction actually happens, and particularly spaces where Indigenous and Canadian state law meet. And so what happens when those jurisdictions meet in these crunchy quotidian ways in the middle of a crisis is really what I hope is captured in the report. And so if you'll go to the next slide, Cynthia, when you get to a call to action like this one, number 22, which calls for the immediate and ongoing financial support for checkpoint staff until the end of the pandemic, and that this support should include appropriate compensation, leave, training, mental health support, and traditional healing for checkpoint staff. As you can imagine, there are a slew of stories behind this. And so I just want to talk a bit about some of those. Lots of Indigenous communities across BC and Canada installed checkpoints during the pandemic, or what were also called access points, or what were sometimes provocatively called roadblocks in non-Indigenous media. And in the case of the ilhqot'in Nation, all 6 communities installed some form of checkpoint during the first wave. Half of those communities passed ban bylaws to support the checkpoint, so invoking the jurisdiction that they have recognized in the Indian Act to, quote, provide for the health of residents and prevent the spreading of contagious and infectious diseases. But whether or not they invoked the Indian Act, by setting up checkpoints to monitor travel, we heard clearly from the communities that this was an exercise of ilhqot'in law and jurisdiction to protect their citizens on the basis of their knowledge of their communities and of epidemics, as Chief Joe was talking about earlier. So, for example, when one community put it to the elders, they unanimously endorsed the checkpoints. And if you'll just go to the next slide, please. This decision to install checkpoints was also validated by the UN Special Rapporteur on the Rights of Indigenous Peoples, who specifically named checkpoints to be one of the most effective measures for Indigenous communities and an expression of their collective right to autonomy as part of their right to self-determination. So what's interesting is this is really a measure where ilhqot'in law, international law, and Canadian law seem to be in sync in principle. So if you'll go to the next slide. In practice, checkpoints were an incredible feat of coordination, and we heard about this both at the community level and at the nation level. As Jenny Philbrick, who's the executive director of TNG, pointed out, the nation has experience evacuating people because of wildfires and other kinds of environmental crises. It's gotten good at getting people out of the communities, but to keep people in the communities, she said, that's a totally different beast. And so the checkpoints were there to support that beast, to support that goal. But as we began to interview community members and chiefs and staff about the checkpoints, we learned that where they really shone was not just in limiting travel and for contact tracing purposes, but as a method of education. So as Chief Joe talked about, in fact, in most cases, the checkpoints did not actually strictly close communities, but acted more as a kind of safe point of contact to share resources on current pandemic risks and protocols with anyone who approached. And I think that this is extra important given the distrust of the healthcare system and the racism in the healthcare system that, you know, Mary Ellen has written and spoken so extensively and eloquently about. But the checkpoints, of course, the other side of that is that they put an incredible strain on staff. So as you can imagine, being the person whose job it is to advise someone from a neighboring community that they probably shouldn't come in and visit their family took an incredible toll. And it brought on conflict. And being the public face, really, the sort of front line against people's frustration with pandemic restrictions, I think was incredibly hard. And we heard so much about this. So that's why the second half of that call to action, I think, is so important, focusing on supports for checkpoint staff. But the first part of the action about ongoing financial support just to sustain staff until the end of the pandemic was itself a kind of complex battle, which I think reveals a lot about the sticky intricacies of how systemic colonialism works in amongst the minutiae to undermine Indigenous jurisdiction, even when there are good partnerships and people ready to problem solve. And so in principle, it really appeared that the Canadian and BC governments supported this measure. Dr. Bonnie Henry was heard on multiple occasions to say publicly that she supported Indigenous self-determination and that the decision to impose travel restrictions should be made by communities. And then similarly, at the federal level, the Indigenous Community Support Fund was specifically modeled so that communities could determine their own needs and use it in their own way, including on checkpoints. And this was an improvement over what the ilhqot'in experienced during the 2017 wildfires, when there was no direct funding like this. And so every expense had to be justified. But in practice, that ICSF funding allocation just simply wasn't enough. It was quickly expended on the immediate needs of citizens, and staffing 24-hour checkpoints was an expense well beyond its reach, which meant that the nation then, of course, had to turn to traditional pools of funding where checkpoints, it turned out, were not eligible. So this is a classic situation where under one pool of funding, it's eligible, but there's not enough money to support it. And then under another pool of funding, the money is there, but it's ineligible. And it's a confounding thing because in every other province, checkpoints were eligible. But in BC, the nation found out there were kind of two main sticking points. First, there was a conflict between the Western science perspective, which questioned the cost-benefit analysis of checkpoints, and ilhqot'in knowledge, which dictated that this was the best option for keeping their community safe. So basically, that knowledge was being questioned at the provincial level. At the same time, communities came up against what we call in the report a false equivalency between First Nations governments and non-Indigenous communities. so municipalities essentially. There's no real policy structure in place to support Indigenous emergency initiatives that differ from the kinds of measures that are available to non-Indigenous ones. So if an Indigenous community comes up with a plan or an approach or an idea that the province hasn't anticipated in its dealings with non-Indigenous communities, basically they just don't yet have the bureaucratic infrastructure to support it. They don't know which policy to plug it into. And so again, this is a case where once you get into the bureaucratic minutiae of things, that's where it ends up getting hamstrung in the context of Indigenous nations accessing the resources that they need to put their law and their decision-making authority into practice. And so without the money, and after many, many hours of advocacy and submissions and resubmissions upon resubmissions, the Tsilhqot'in communities, all 6 of them had to suspend their checkpoints after about a month or so. But the advocacy did not stop there. And there was a real willingness on the part of government partners and a great deal of hours put in by everyone to try to build the policy infrastructure needed. And so by November, an emergency management BC policy was amended to include checkpoints as eligible for reimbursement under certain conditions and for a limited period of time. And we now know that that policy change has served the communities in this most recent wave of the pandemic. And so the rest of the story behind this call to action is that the success of that partnership needs to be built upon to ensure that there are the full funding supports in place before the next emergency, so that Tsilhqot'in jurisdiction doesn't get caught in the snare of the minutiae again. And with that, I will turn it over to Crystal.
Abananis, good morning all. Thank you, Mary Ellen, Chief Alphonse, Jocelyn, and Emma. And also thank you to the Indigenous Learning Support Initiative and the UBC Learning Circle for hosting this webinar and the opportunity to discuss the COVID-19 report through the experiences and voices of the Tsilhqot'in. I'm also proud to discuss what I know is a cornerstone and most important issue, the health and safety of our people. As expressed earlier, my name is Crystal Fry. I'm a citizen of Estila First Nation. It's one of the 6 Tsilhqot'in communities that make up the nation. Over the years, I've worked in several capacities at the nation with the communities from 2006 to 2017, prior to providing consulting services for Indigenous communities. Over the years, I've been passionate and adamant that mitigating, preparing for, and having the adequate resources to respond to emergencies within the nation should be a fundamental baseline for the communities. I've been fortunate to provide facilitation support to the Collaborative Emergency Management Agreement table between the Tsilhqot'in, BC, and federal governments. As the first tripart of its kind, the table aims to streamline emergency response, eliminating barriers, and providing emergency response services comparable to the government partners. When I was working as the executive director at TNG, I have vivid memories of trying to respond to emergency situations. And now I'm glad to see the progress and partnerships that have been built up over the years. The partnership that TNG and UBC formed to document the experience of the nation through the wildfires to the pandemic has now taken shape in the 2 reports, The Fires Awakened Us and the Tsilhqot'in COVID Report. The Tsilhqot'in COVID Report tells the story from the first-hand accounting of several people in a time of crisis. Several emergency staff, the Tsilhqot'in Women's Council, the Tsilhqot'in Nation's mental health clinicians and health directors, and community checkpoint staff. They all met with us to share their experiences, even when very painful to tell. I wish to extend a huge thank you to all those brave people who supported this report and discussed what are very difficult issues. Both reports form a written documentation of what happened, ensuring that the voices of the people recounting their experiences will stay alive and the information will be easily accessible for the future. My portion of today's webinar focuses on what now. Much work needs to be done to prepare for the fallout of COVID-19, keeping in mind that the communities are still in constant recovery from the traumatic 2017 wildfires and consistent flooding. But at the same time, we're still in the midst of a pandemic, so preparation also needs to happen to be equipped for response, but in a strong and supportive manner to ease the strain on people and resources that are currently being challenged. So this slide from the COVID report, an important call to action, number 28, addresses the need to prepare for the social impacts. The ilhqot'in Nation calls on BC and Canada to establish a multi-agency health and social table to develop community support programs and policies that adequately and meaningfully address the full range of health impacts created and exacerbated by the pandemic. Jody Nishima is the TNG social lead, and he's also been the lead for this COVID report since the beginning of the pandemic has been capturing the vast social needs that have emerged in the nation. This information will form an entire social strategy to combat the overlapping concerns from COVID-19. Many of these issues are still unknown to this day, but many issues have already been identified through the interviews. However, this cannot be done alone or in isolation. The resources, innovation, external support, and reliance on partnerships are all very critical in the success of managing the broad range of health and social impacts in the community. This work requires an administrative body to ensure consistency and reliability in the massive coordinating details required to pull multi-governments and multi-agencies together. The work could involve developing the wraparound services for people in the areas of addressing long-term mental health needs, combating and supporting burnout of frontline staff and leadership, developing alcohol and drug strategies and programming, establishing infrastructure policies and programs, creating employment and back to work plans, providing trauma and emotional counseling, developing education supports for the lagging educational needs due to COVID. As you can imagine, this list is long, and this is not an exhaustive list of the needs that have emerged. I would also like to commend Mary Ellen for her very important report exposing the vulnerabilities and the inequities of Indigenous people in the healthcare system. The scathing report identified very well the health challenges in communities and highlighted the concerns around compounding illnesses, which leave Indigenous people more vulnerable and more susceptible to illness. The report showed the deep-seated fear and mistrust in the healthcare system. This alone requires its own wholesome strategy. What we know around the world right now is that people are very resilient. Indigenous people are resilient, and the ilhqot'in Nation is and has been resilient. Not all work can be done on paper or in a meeting room, virtually or however. It'd be nice to be in a place and time where we can witness the ilhqot'in Nation when faced with an emergency to not have to expend copious amounts of energy defending their needs to protect their communities. And for the nation to be unencumbered to immediately implement emergency response in their own way. This points back to the fires awakened us. There are outstanding calls to action that are within the report that carry forward to today's situation and will carry forward to the next emergency situation and so on until it has been fulfilled. One such call to action is to establish a reserve fund for emergencies for the ilhqot'in Nation to draw upon when necessary and under the rightful jurisdiction in protecting their vital resources, their people, their land, and their property. Next slide, please. Now from the COVID report, call to action number 6 addresses the need for the nation to be equipped for response, but in a manner that provides support to the existing staff. The ilhqot'in Nation calls on all levels of government, regional, provincial, and federal to develop a ilhqot'in Nation and British Columbia crisis response strategy to ensure the nation has access to staffing and resources that can meet their emergency needs, as well as continue to meet ongoing and expansive health needs of the communities in an emergency. The nation has displayed a remarkable show of action in their crisis response to the pandemic, but a jointly developed strategy to ensure there is sufficient capacity to meet the ongoing health and emergency needs is necessary. We are entering the wildfire season and the flooding season, and the ilhqot'in Nation will be faced with managing emergencies within emergencies again soon. A plan outlining sufficient capacity to support the overburdened workers and COVID fatigue senior staff is essential. This report, documented in such a delicate time, focused on the institutional environment that restricts Indigenous governments from enforcing their full jurisdiction, not the people. The changes that are necessary needs to happen at the very top, in the policies, in the legislation. Big changes happen in times of jurisdictional clashes. However, in this situation, under the authority of leadership protecting their vital resources, there is no better time than now to recognize this. I also want to make time to make sure that we acknowledge the very hardworking staff in the emergency teams and health teams. They've done an amazing job. Their efforts are not unseen, so thank you very much. And thank you for the opportunity to present today. So Chanel, yeah.
Well, thank you to the panelists and for Crystal, Jocelyn, Emma, thank you for walking us through the findings and the method, the context. I want to bring in Chief Joe Alphonse. We're getting some questions and we're going to come back and forth to the panel, but I want to bring back Chief Joe first of all. And one of the themes of the questions that are coming forward, Chief Joe, is the issue of, what are your hopes for the impact of this report on other Indigenous communities? Like, obviously, the nation has come together, the strength of your nation to be able to protect. We're still in this pandemic, we're still dealing with it. But you've given so much with this report. Even your own laws that you developed to protect your citizens are there. Can you talk about, what are your hopes with this report for other nations? Like, is this a gift from the ilhqot'in to other nations in BC and Canada?
Yes, I think, we, during times of crisis, people look for leadership, and there should be, the larger Aboriginal organizations should be providing these type of reports. That's not happening. I don't see it. I don't see AFN. I don't see BCAFN, the union, the summit, none of these. We want to go do this and do our report, for the benefit of future ilhqot'in members. But we've had a lot of challenges as First Nation people. We all come from the same background. We have to deal with all the same type of government, Canada, BC, and what we experience, we don't want anybody else to experience that. And we fought for our Aboriginal title. You'd mentioned we were the first Aboriginal title. What you forgot to mention is we're the only nation to win title anywhere in the world. We did that because other nations were willing to share and help us along the way. And this is a way of giving back, providing and making sure, I don't care what type of Indigenous person you are, if we can make life just a little bit easier for them, then this is all worth it for us, whatever. And we have to reach out and help one another as Indigenous people. Learn to hold hands, not pull each other down. That's what this report is. We're doing it for ourselves, but we want to share it with anybody that's willing to listen. You don't agree with our reports, that's fine. We all have different experiences. You're going to have BC that isn't going to want to, they want their Indians to be quiet and submissive. I'm not quiet. And I'm going to talk about the struggles that I've had. I grew up and wanting First Nation leadership to be in mainstream media and stuff like that, and they weren't there. One of the promises I made was I'm going to put myself out there as many times as I can. I may not be the best speaker, I may not be the best leader, but I want all these young ilhqot'in people to listen to us in the media and to know that we're heard, we're going to be heard, and we're going to put ourselves out there. So if I can get and win title with whatever experiences I have, then a whole generation of Indigenous people having the faith and knowing that they're part of and their voice matters, wait till they mature. That's what this is all about. Passing that on to the next generation. We're not going away. Canada, BC, deal with us.
Thank you for that. I think that just that gift to other nations and to your own citizens and to young people, and that, like, there'll be First Nations students listening today. And I think for all First Nations people, seeing this report, reading it, listening today is going to drive people back to our own communities. To this method is pretty amazing. And in terms of what you're saying, Chief Joe, about the need for this to come now out at the provincial and national levels through the work of First Nations organizations, I think that we're going to see that. We're going to see that, and because this is the go-to standard to look at it. And I'm going to just redirect one of the questions to Emma. Emma, you spoke in your presentation about people at checkpoints, like how challenging it was to do checkpoint work and its safety, but it was also about relationships, protecting, and how hard it was, and it still is, for people on the front line. I've heard that across on many First Nations, how challenging it is to do checkpoint work, and how sort of like government and other people were like, oh, you're just gonna like be at a checkpoint, like it's whatever. But you're regulating who's coming in, you're regulating who's coming out, you're giving information, you're also exposed to all the challenges that people are experiencing. And and one of the questions that came in was about whether or not supporting frontline staff with sort of mental health programs. And this report really is the first one I've read that takes this seriously. What it was like for people at the front line to do this work, and to think it's like checkpoint security job. It's so much about transmitting knowledge, culture, supporting, protecting, informing. You talked about that. And how do people take care of themselves, and what kind of support have they had? I wonder if you can just respond a bit to that question and comment a little bit more on the findings around what we need to make sure we put there to honor and respect that vital role that isn't just like someone as a checkpoint greeter. It can be anybody. It's just a shift that's done. It's like we think about these key roles in community, that this emerged to be one of the most important roles.
Yeah, the interviews that we did with checkpoint staff, I think, were, for me, some of the most powerful. Just as you've said, Mary Ellen, to highlight what a complex job it is. Not just a day job. I mean, these were operating 24 hours. They had fire going. They were drastically understaffed in most cases. It was hard to staff them because it was a hard job, and because there was uncertainty around funding, as I talked about. And so I heard from checkpoint staff, but also in interviewing the mental health practitioners in each of the communities, hearing from them the kinds of supports that they needed just to be able to support those frontline workers, and where things were coming short. Just again, really hammered home how important that was. I mean, we at one point kind of talked about this irony when we wrote the wildfire report. We were writing about checkpoints that the RCMP had set up in contravention of ilhqot'in jurisdiction to keep people out. And now we're writing about checkpoints that ilhqot'in communities had set up to keep people in, that the RCMP wouldn't enforce. And so another part of the story that I wasn't able to talk about today, but that is covered in the report, is the issue of enforcement. And so it's a long story, and it's conveyed in chapter 4 of the report, but essentially there was no enforcement support from RCMP. And there was there were a number of legal questions around that. And so when there were conflicts, so eventually, or really from the start, when there were conflicts for the safety of staff, they were told to let people through. And then a protocol was sort of triggered when something like that happened. And unfortunately, there were quite a number of conflicts, and this is why we really stressed how important that healing and mental health support is. And so we've listed a number of different things in the report, but one of the things that we heard loud and clear from all the communities are around traditional healing options and having those right in the community. And of course, as well, accessible by distance when we're in a situation like this where everything has to move online. And so I think that that's something that we really want to stress, and again, I think is highlighted better in the report. I don't know if Chief Joe or Crystal, you want to talk a little bit more about what some of those things are that you hope to put in place.
I was going to say some of the land-based healing methods. I think, Chief Joe, you have equine therapy. And I think, there was a lot of pictures that came through as well. And we want to highlight those that there was a photo contest that came out. And a lot of ANHAM members actually put pictures in, and they were out on the land and enjoying their time. And I think that's important as well to kind of talk about. But Joe, you've had a lot of years of discussion with governments about bringing more of a land-based healing as well back to the community, and even land-based education for the youth. If you want to talk about that at all.
Yeah, I think we're, the people at the cut block, it was really difficult for them. There was no support from our CMP. Really illustrates the fact that RCMP and enforcement is not an extension of our governance. We need to create that and reestablish that in our communities, whatever. You're going to see times of lockdown, the underside of your community's belly, and it's not going to be pretty. You're going to see addictions, and you're going to see a lot of stress. Our people are social people. They want to socialize. The elders especially, it's really hard on them. They look forward to their little bingo evenings and stuff, and so you're not going to have any of that. So you're going to have to find creative ways. This is a perfect time to get back out on that land. Encourage that. Tell your members to go out. It used to be our people for pastime would go in the back country. Now people think their pastime they got to go into going to nearby town to go to the Walmart or whatever. That's our values have shifted. We got to shift back to the way we used to do things. Being on the land is also it's soothing. It's better than an hour-long counseling session or stuff. So you have to encourage that. We have horse program. We try to encourage people to get back into activities of riding a horse as opposed to a motorcycle or a quad. It's much more healing, and anything that's related to that. This is very stressful time, continues to be. We're not out of the woods yet, but anything that we can do to grab a fishing rod, go down to the river, or go grab an axe, cut a hole in the ice, and go do some ice fishing. Those are things that we really need to promote and encourage, and it brings families back together. It's whole family units, and people here are going to go out, and they're going to want to go out and do that stuff too, and stuff, and children especially. Really, it's we often forget about the children in our community too, and they need that attention during this time.
Thank you so much for that, Chief Joe and Crystal, because the whole chapter that you have in the report, which is chapter 5 on the health and social impacts, you're holding that still, and I really see the pressure building for First Nations children and families who have had isolation. I know people still have some contact, and the vaccines have come out, but there has been a lot of missed ceremonies and missed opportunities to celebrate, or really small things where we've had to recognize the passing of people, just transmitting that language, culture, knowledge on the land. I mean, I'm really hearing, and I'd like to hear from you a bit more, Crystal, of, this is a really good explanation to governments and others about the need to fund those land-based healing programs, those land-based school programs. People are talking about how kids have missed a lot of school, and they're talking about like a deficit, like it's a big gap. We're also hearing on the First Nation side that a lot of kids have spent a lot of time with their family, and families have become closer, right? It's not a one size fits all, but for First Nations families in particular, the spending more time with the children, but also thinking about their needs and seeing the need to do things differently. I wonder if you can comment on that a bit, Crystal, about like what you see from that chapter about the health and the social impacts. And the Chief Joe's talking about the kids and land-based healing, but there's a real need to support Silcotin services. And this isn't something that you just put forward with the pandemic. This is something you've been putting forward for more than 20 years. But now is really the time to invest in it, I would suggest, as an outsider seeing this report. But I wonder if you could share your thoughts on that with us, Crystal.
Yeah, I think that was a tough chapter to, have people comment in and add to, but for the communities, if there's this continuation of, how do you rebuild, and how do you make sure that everybody's in the healthiest state that they possibly can be. And that was a lot of the recommendation about, and the communities were already moving towards that, is land-based healing. It was actually one of the first requests that was made to the partners, the federal and British Columbia partners, was for funding for land-based healing, so that at the same time this is happening, people can at least get out on the ground, still visit, but be in a distant setting, have traditional practices happening, have some teaching happening, but still be safe and appropriate. And there was months even that had lasted in even one of the communities where they hadn't even been reached by the school district to have their children move to laptops. And so that lag is, like not even having access to some internet, some computers, and not having that touch, but then listening to people in Vancouver having their kids already in the next week already enrolled in school. So that weighs heavily in the communities of like, how do you make sure that the kids will succeed? And that's kind of the discussion that happened in the background between some of the interviews, of just making sure that the kids are at least learning in a different way and on the ground, and building them up. And so I think those are big pieces that still need to get figured out and put together. And that was that call to action, was to pull everybody together, make sure it's a multi-agency, multi-government approach to ensuring that there is some work together to build a larger collaborative strategy on building up and building back.
Yeah, thank you so much, Crystal. And I'm just getting some messages as well while you're speaking from some other First Nations leaders who are saying how much they appreciate your voice, and Chief Joe talking about the need to build back in a way that absolutely invests in cultural safety for children, whether they're Silcotin, from whichever nation, to make sure that all of those systems, as we've seen, the racism and the struggles, to make sure that there's no going back, right? So really a lot of people lifting you up today for this important work. And I want to bring in Chief Joe again, if he wants to comment on this and talk about a little bit more about, what worked well to support and protect people, and as you on an ongoing basis, because clearly it's about culture, it's about language, it's about values, it's about Silcotin laws and approaches. But what you really feel, Chief Joe, has worked well?
I think anything that's based on our culture has worked well. It's pulling the communities back together and really having a long, hard look at our community. Addictions are going to be huge, but at least, you know, a pandemic like this is going to bring that to the forefront, and it's going to force our communities to really start dealing with those issues that need to be addressed. And but the thing I kind of wanted to talk a little bit about too was, you know, where does this stand in all this? Where's Emergency BC? You know, these organizations are supposed to be there to facilitate, help, assist. You know, my community, we just got to the point where we didn't depend on them anymore. You know, you have to soak up so much time and resources just to put proposals into them, just for them just to turn around and ask for more information and more information and more information, and then turn it down. We didn't have those kind of resources. And, you know, we don't need anybody holding our hand. They have financial resources. They should just provide those resources to First Nation people, and we can manage on our own. You know, we don't need them. And it was really frustrating. 2017 fires, my community, you know, they still owe us $500,000 since 2017. You know, that affects our audited year every year thereafter. And when something's going to impact your audit as a First Nation community, it's going to also affect potential opportunities your community can have in the future and stuff. So in the end, my community, we said, we're not even going to respond. We're not even going to depend or look at EMBC in terms of having assistance or anything like that for my community. There just, you know, there's no I can't think of any level of government that has and is held more accountable than First Nation people. Like we have to justify any of our spending more than any other level of government anywhere in or organization anywhere in Canada, over and over and over again. It seems like I'm still dealing with 2017 fires every year. You know, where March just came and went. We've just had to deal with that all over again. So we're starting. We've hired lawyers. We're going after them now. So you know, it's and I'll continue to push that. And I think they hope that we're just going to go away. We're not going away. Maybe my advantage is they're going to continue to, you know, underestimate us. So, you know, that's something you're going to have to be prepared for. We have financial resource we set aside for emergencies, because you should be planning for emergencies. You know, it's a new world that we live in. You know, this COVID-19. You know, we have to take things we learned from their practices, safe measures, and take that into going into the future. You know, as we're dealing with this, we're preparing for flood season, and as soon as flood season's over, we're going to dive right into fire season. It's just one crisis right after another. So if you can prepare, because don't be dependent on other governments. You're going to end up in a bigger financial crisis than you think. So that's my last message. I want to reiterate to everyone.
Yeah, I really appreciate that, Chief Joe. And I think the report really, and your words today, really speak to how multiple shocks over time, you know, when you go to have to cope with a pandemic and you're still coping with a shortfall because government didn't stand there for you and support you to deal with the crisis from a few years. I think the public really needs to understand how, for First Nations governments, how hard it has been to address the pandemic when you have that. And I really appreciate you sharing those words. And I know there's some people from Emergency Management BC participating and listening today, and I hope they carry that back to the highest level And certainly, I certainly support you personally on that front, because we've seen so many First Nations where without a proper land base, without proper resources, fighting the pandemic, it's like having one hand tied behind your back. You already have like a shortfall from the previous shock. So Canadians and others maybe don't understand that. So one of the important things with this piece of research and this report is to really shows, where the gaps are that have to be filled. And I know we're getting close to the end of the seminar, but I did want to make sure that we have one of the questions, if it's possible, Cole, just the last question, perhaps to Dr. Jocelyn Stacey. There was a question about data and referencing that the HealthTIC had taken, a Privacy Commission complaint and saying not enough data is shared with governments directly. And there was a mediated agreement and settlement. I wonder, Jocelyn, if you could just maybe by way of closing, comment on this, because who shares what, who has what rights? This is so important. If you don't have information, how can you plan for a pandemic? So I really want to give the response, our last to that final question, to you, Jocelyn.
Thank you so much for that. And thank you, Juan, for the question. It's a great question. And I'll just insert the caveat that I'm now pandemic parenting. So I will do my best to get my answer out before there's an interruption. I think what's really interesting about what's happened with the communication. So that's Freddie. What's happened with the communication piece? We all know that communication and data collection is a crucial piece of pandemic response. And what happened with the complaint to the Privacy Commissioner was really interesting, because we now have DRIPA, right? The Declaration on the Rights of Indigenous Peoples Act. And there is a very clear legislative toehold there that can be used to interpret obligations in other statutes. And this was a big missed opportunity for the Privacy Commissioner, who disappointingly found that basically First Nations in BC were entitled to just as much information as me as a member of the public, right? That adequate information was being provided. So in terms of that question about where's self-determination at right now and how's it being recognized, there's still a lot of work to be done. And I think one of the important pieces of this conversation that's come out, that's reflected in the report, is that good work is happening, but it takes so much work. And when that is happening in the middle of a crisis, we have to think about what is being lost when all of that time and the resources, the capabilities of staff within Indigenous nations are being dedicated to having to advocate for and negotiate for basic needs being met.
Thank you, Jocelyn. And it is kind of heartwarming to see the pandemic parenting and see the kids, and to recognize, again, I just want to say as moderator, my final words are just to stand you all up and thank you so much for this remarkable report and the work, and stand up Chief Joe Alphonse and the Chiefs and our ongoing advocacy, and also to recognize that you're all juggling parenting and managing the pandemic in your own personal ways, which is giving so much to share. And thanking Ursi, UBC Learning Circle, and the Center for Excellence in Indigenous Health for convening this. And I'm going to pass it back over to Cole, but it's been wonderful to spend some time with you today on something that we're all going to be talking about a lot in the months to come.
Great. Yeah, I want to echo those comments. Thank you all so much for joining us and sharing your perspectives and experiences with us today. It really is invaluable, and I feel like I've learned so much. Popped up on your screen here are some upcoming events we have at the Learning Circle for the month of April. Then Kaini Wellness Center is going to join us next week. And then on April 27th, we're going to collaborate again with the Indigenous Research Support Initiative to chat a little bit about Indigenous lenses on health systems transformations and research. So that's going to be a really interesting session, and we hope to see as many of you out there as we can. I don't want to take up any more time because we have officially gone past our time limit here today. So thank you all very much for joining us, and until next time, take care.
Thank you.